The child mental health crisis is magnified by a broken healthcare delivery system that completely ignores a student's daily reality. Right now, getting a child help usually means pulling them out of class in the middle of the day and trying to navigate a maze of external, disconnected clinics. That forces working parents into a terrible position. They either lose wages and pay high out-of-pocket costs to transport their kid to a clinic, or they let a developing mental health issue go untreated. The standard way we deliver health does not fit into the rigid schedules of education and family survival. For local school districts across Georgia, this logistical headache is about to become an urgent, mandatory problem. The state has passed HB 268, which mandates strict new mental health support requirements that schools must fully implement by July 2026. Administrators are effectively being asked to build an entire clinical network from the ground up before the clock runs out, a massive expense most districts cannot absorb. This is where MentalSpace School comes in. It acts as an infrastructural plug-and-play solution designed to bypass traditional healthcare bottlenecks entirely. MentalSpace brings immediate teletherapy directly inside the school building, eliminating travel. This direct pipeline is fully compliant with HIPAA and FERPA regulations. Same-day care allows for rapid crisis intervention, including suicide and violence prevention. By integrating the delivery mechanism right into the hallway, MentalSpace provides vital intervention at the exact time and place students need it most. To build trust, MentalSpace assigns dedicated teams of diverse, culturally competent, and licensed therapists to specific schools, turning them into familiar, consistent figures. The infrastructure extends beyond the students too, offering built-in wellness support for staff and counseling sessions for families. Then there is the cost. The system integrates directly with massive networks of existing payers, shifting the financial burden completely away from the parents. MentalSpace accepts a wide range of commercial insurance providers, including Blue Cross Blue Shield, Cigna, Aetna, United Healthcare, Humana, Peach State, CareSource, and Amerigroup. Most importantly, families using Medicaid are completely covered. Their out-of-pocket cost is exactly $0. By tapping into these massive provider networks, the system effectively eliminates the severe financial strain that typically comes with seeking private therapy. So, what happens to a school's population when you remove all the logistical and financial barriers to getting help? This chart illustrates the primary clinical outcome, an overwhelming 92%, leading to an 89% improvement in student attendance. And zooming out to the community, the program boasts an 85% family satisfaction rate. For school districts, these metrics provide the structural evidence required to meet the state's HB 268 mandates without additional administrative overhead. MentalSpace provides treatment for the individual student, while simultaneously stabilizing the entire educational and administrative ecosystem around them. With care embedded directly into the school day, no parent should ever have to choose between keeping the lights on and getting their child the psychological support they need. Administrators managing the 2026 transition, or parents advocating for better support, can initiate a school partnership today. Reach out to set up your district's program by visiting mentalspaceschool.com or emailing mentalspaceschool@chctherapy.com.